Welcome. Thank everyone for joining us for the second meeting of the Impacts of Firearm Violence Subcommittee. California's Mental Health Commission created this subcommittee to explore the impacts of firearm violence on individual, family, and community mental health and well-being and strategies to respond. My name is Keandra Bunch. I am a commissioner on the state's Mental Health Commission, and I chair the Impacts of Violence Subcommittee. This was a really important committee for me. I am a supervisor at Department of Mental Health, and I supervised our START program, and that's our school threat assessment. So I am very excited to be a part of this committee. As we meet today, we are reeling in the wake of not one, but three more mass shootings in our state over the last few days in Monterey Park, Half Moon Bay, and Oakland. 18 people have lost their lives in these shootings, with more injured. The tragic loss of life and devastating harm to quality of life reminds us of our aims for this project: to understand the problem, to identify solutions, and to help implement and elevate these solutions statewide. We're also reminded of the fact that while firearm violence affects us all, some members of our community are disproportionately affected. We can't have a meaningful conversation about firearm injury and death without acknowledging the devastating impacts on our African American, Hispanic, and Asian American communities. The recent shootings underscore the importance of engaging and including these voices in our work, of finding solutions that are effective as well as culturally appropriate. As we continue with today's meeting, let's move forward with renewed commitment to engaging our community, hearing those who are struggling, and working together to solve this problem. I'm hopefully joined today by our subcommittee vice chair, commissioner, and Santa Barbara County Sheriff Bill Brown. Courtney, are you able to see if?
Yeah, Sheriff Brown is apparently on a flight right now, so he is not going to be able to make it, unfortunately.
Okay, I didn't know that. So is Commission Chair Mara Madrigal-Weiss on? I believe she was going to try to join today.
I don't see her yet. I don't believe anyone is in the waiting room, so she might just be a couple minutes late.
Okay. Well, if you see her, let me know, and we can give her the opportunity to speak if she would like to. But before we move on to our agenda item, I want to take some time to invite anyone else on the call to share their thoughts regarding the recent shootings. I'm sure it's weighing heavily on everyone, and I'd like to offer all of our attendees a chance to speak on this topic. If anyone would like to speak, please go ahead and raise your hand. And I can't tell if anyone wants to. Are you able to see that, Courtney?
Yeah, it looks like Selma. Melissa, would you unmute her?
Hi, sorry for my camera being on in advance. We're having really bad winds out here, and if I try turning on the camera, the bandwidth is just going to die. So pardon that, but in regards to these mass shootings that have happened, first of all, they just hit very close to home in regard that I was born in Monterey Park and I went to school in UC Santa Cruz, which is only half an hour away from Half Moon Bay or so. So these are quite literally in our backyards now. And that just the thought of that, we want to think that we live in California and we have good gun laws here, but unfortunately that stuff still happens here. And that's why, committees like these are important in making sure that we're doing everything, before we have to get to that extent to make sure that gun violence is drastically reduced. But also just, working, I am the director of education and youth advocacy for the Central California LGBTQ+ Collaborative. And because we work with the LGBTQ+ community, that already, right, puts a giant target on our back. As you know, with obviously Pulse, but more recently the Colorado Club Q shootings. And we actually had Modesto PD come out and give us a presentation the day of the Half Moon Bay shootings. And just, living with that and realizing that gun violence and mass shootings is going to be a threat in our community and in our world at large, and it still is, and what we can do then to make those things better. So, yeah.
Thank you. Thank you, Selma, for your words. It looks like Stacy would also like to speak. Can someone unmute her?
Hi, Stacy Hiramoto with REMCO, the Racial and Ethnic Mental Health Disparities Coalition. And I thank you, Commissioner Bunch, for showing respect and acknowledging the many tragedies and losses due to gun violence in recent days. When you and I first exchanged emails on this topic, there was but one mass shooting, but unfortunately, there have been others since then. And I have then learned that in this country, there has been more than one for every day since the start of the year. It is inconceivable. It's why this committee is important. I do want to say a few words, though, in regards to the Asian American Pacific Islander community. The two recent events show that no community is immune, including the AAPI community. However, coming on the heels of the increased hate crimes against the entire Asian American community during the pandemic, these shootings are even more devastating. The harassment and danger faced by the AAPI community, whether young or old, in the recent years has just really been a horrible thing. There are things that could have been done to address this increased discrimination against the AAPI community, even by this commission. There were missed opportunities. However, this is not the time to go over this because it does not have to do with this particular committee. And I don't want to take time away to pay respect to the victims of not only the shootings of the Asian Americans, but the others in Oakland and others as well. I'm willing to talk to anyone, however, about what I'm referring to and what might be done to improve the situation. Thank you again so much for this opportunity.
Thank you, Stacy. And I know we're scheduled to meet next week, so I would love to hear your thoughts then.
Keandra, you're muted.
Was I muted that whole time?
Just for the last sentence or so.
Okay. So thank you, Stacy. I don't know if you heard that part, and we're meeting next week, so I'd love to hear your thoughts on what the commission can do to address the discrimination that's occurred. But I was also saying that I see that our chair has joined, so if we could see if Chair Madrigal Weiss would like to say anything.
Thank you. I appreciate your leadership on this, Commissioner Bunch, and I'm just here to listen. So I appreciate the opportunity to be here.
Thank you. Thank you for coming. So that brings us to our meeting today. The focus of today's meeting is keeping our schools safe from firearm violence. That includes identifying and working to mitigate or manage threats to our students' safety, building healthy relationships in schools, and working together to create a safe and positive school climate. First, we'll hear a presentation from Dr. Melissa Reeves, a nationally renowned expert on threat assessment and management in schools. Dr. Reeves will give an overview of threat assessment, talk about effective models for identifying and following up on individuals at risk of violence, and outline some best practices. Then we'll move on to a panel discussion with participants chosen for their expertise and lived experience in the areas of school safety, threat assessment, and building a positive school climate. Through this discussion, we hope to expand on the information Dr. Reeves presents and talk effective real-world solutions. Before we begin with the presentation, we have a couple of reminders for folks joining us remotely. At this time, I'll ask Commission staff to go over a few housekeeping items.
Thank you, Commissioner Bunch. To reduce background noise and interruptions, we ask that you keep yourself muted while not speaking. You can mute and unmute yourself by clicking on the microphone icon at the bottom of your screen. If you're calling in, you can mute and unmute yourself by pressing *6. If you have a comment or question, select the raised hand option under reactions at the bottom of your screen. If you are calling in, you can raise or lower your hand by dialing *9. Video is encouraged, especially when speaking, but certainly not required. We also would like you to know that our chat feature is limited throughout the meeting. This is part of our effort to ensure all participants have equal opportunity to comment, including those not on Zoom. Thank you for your support in creating an inclusive and supportive hybrid meeting space. The chat feature will be available for participants to communicate with commission staff regarding technical needs. You can message the host and a staff person will respond. Please hold questions for presenters until the end of the presentations. And back to you, Commissioner Bunch.
Okay, now moving on to our first agenda item, Dr. Reeves will present on threat assessment and management in schools.
Good afternoon, everyone, and thank you, excuse me, so much for having me here to talk about a topic that's actually near and dear to my heart, and hopefully a topic that, as best as we are able to, that can definitely prevent these tragic events from happening, such as what you have experienced just these past few days in California. So what I'm hoping to do in actually a very short amount of time, I'm going to give you a lot of information, but you do have access to the PowerPoint slides on the subcommission website, is to provide an overview of best practices in behavioral threat assessment and management, or in the short term, we like to refer to it as BTAM, in K-12 schools. But discuss also, how does this fit within a comprehensive approach to school safety? And then how can we utilize it effectively for both prevention, but also for intervention when we start to recognize that there's concerns? And one of the most important things for those of us that have worked in K-12 schools is that honestly, nowadays, crisis prevention intervention is expected. When I started in education 25 years ago, this was not a topic we talked a whole lot about. Unfortunately, it is very much at the forefront of a lot of the work that we do in schools. So we need to be ready to prevent as many things from happening as possible. But when an event does happen that impacts our school and our community, what are those interventions and supports that we can provide to really mitigate some of that traumatic impact? And what we know is that good preparation and having good prevention protocols in place really does mitigate traumatic impact and can help facilitate recovery, but none of this can be done alone. As I like to say, safety is not any one person's responsibility. It is everybody's responsibility, from our students, our staff, our parents, our community members, at large. And it really does require those multidisciplinary teams and that multi-agency collaboration, which is going to be at the heart of a lot of what I'm going to be talking about today. And one of the most important things too is, especially around BTAM in K-12 schools, is that we need a model that is developmentally appropriate. We need a model that is designed to work in schools. And too many times we've seen adult models that we then try to utilize in schools, and unfortunately, they can actually have more of a negative impact. So the model that I'm going to be speaking about today is really one that is designed for schools, but you will see the importance of also that multi-agency collaboration. Now, when the U.S. Department of Ed put out a document, and they talk about the 5 mission areas of preparedness, and they talk about prevention all the way through recovery. So notice, we're just not saying here, okay, have you practiced your fire drills? Have you practiced your lockdown drills? We're saying it starts with prevention. And if we can put more of our resources into prevention, then hopefully we have less negative things that end up happening as a consequence. So really, where most of our attention and resources need to go is prevention, because we know it works. But we also need to have good protection in place. What are those things that we are doing to make our schools both physically safe, but also psychologically safe? I'm going to talk about climate and culture here in just a little bit, that can help us mitigate negative things from happening. Or if we're really focusing on building that positive climate and culture, when we do have an incident that impacts our community, we built those skills of collaboration and coming together and helping each other out. And we know that that can lessen the traumatic impact. And another way that we can do that is through really good response and recovery. So again, when something happens, what are those types of supports and services that we're providing, not only for those that attend K-12 schools, but also those in the community? And how can we help facilitate recovery? Because as I like to say, recovery is oftentimes the lead into prevention. And so through those recovery efforts is where a lot of times we end up getting more prevention initiatives in place that really, again, can prevent those subsequent negative events from happening. So when we talk about how prevention is key, it really is, but we've got to focus on that comprehensive, safe school climate. And as I like to say, this all boils down to connectedness and relationships. So what are we doing, not only within our schools, but also our community, to really build those positive school climates? We're building those relationships. We're breaking the code of silence that no, when you are telling someone that there's a concern, you are not narking, you are not getting someone in trouble, you are getting someone help. And when we have people that are willing to report those concerns and we're encouraging each other to do so, it keeps all of us safe because we're then able to get in there and intervene early on and build skills. As I like to say, punishment alone does not change behavior. We've got to figure out what contributed to some of those concerning behaviors and how do we build the skills to help them onto a more positive pathway. Also, we want to make sure we have good universal behavioral expectations, especially in schools. You can't have this teacher having these expectations, then this other teacher has a different set of expectations. They're those universal behavioral expectations that really tie into that positive school climate and culture of this is what is expected of each other. This is how we treat each other. This is how we respect each other, and that we're really building that. And the importance of really engaging student leadership. As I like to say, the students are our eyes and ears to so much of what we do, but they also can help us do that collaborative problem solving. They know each other better than anyone, and really empowering that student leadership not only helps to keep our school safe, but it also helps to keep our community safe. And we also have to attend to racism and discrimination. Many times that is underlying violence. So again, it really goes back to what are we doing at a systemic level to attend to racism and discrimination and build those positive school climate and cultures and positive community climates and cultures where everybody feels connected and everybody feels like someone cares. So when we talk about this comprehensive approach to school safety, again, it involves all of these components, really focusing on that school climate, that collaboration. We use what we like to say is multi-tiered systems of supports. What are we doing at that universal level, that tier 1 for everybody? But if that's not enough to meet their needs, then what do we have at tier 2 for targeted interventions that can do more of the direct supports and skill building? And for those where that may not be enough, what do we have at that tier 3 where we can really provide more intensive services or engage our community partners for those wraparound supports? And so where we see is all of this is really, again, integrated learning supports. We can't be working in separate silos. We really have to bring the educational piece of what we're doing, where we're teaching reading, writing, and math, but also with that school climate piece and that focus on psychological and physical safety. And how do we bring all of these together? One of the other important things we know works is universal screenings. How do we do surveys, or what are those types of things we're doing through our prevention programs, where we are getting insight as to how is someone doing, and we're catching them when they're struggling early on rather than waiting for something to get to a crisis moment. And then also making sure that we're using really good database decision making and really good evidence-based interventions, which is what we're going to talk about today when we talk about BTAM. In addition, when the U.S. Department of Ed put out this guide for developing high-quality school emergency operations plans, they talk about functional annexes. And the U.S. Department of Homeland Security has also adapted this language. FEMA has also adapted this language. But when they talk about functional annexes, they talk about the components that need to be put in place to have a really good comprehensive emergency operations plan. Now, one of those functional annexes is called the Public Health, Medical, and Mental Health Annex. And that's really what a lot of what we're going to be talking about today fits within this particular annex, because this is where mental health supports, mental health crisis intervention, behavioral threat assessment and management, good suicide prevention and intervention fits within this annex. But you will also see how it's closely linked to medical, but also what are we doing from a public health perspective? Again, we can't keep working in our different silos, but how do we all work together? So what I'm going to spend, the bulk of my remaining time on is talking more specifically about behavioral threat assessment and management. And what does this look like in schools? And this is an approach that is informed by research and practice. Actually, the Secret Service and the National Threat Assessment Center have been doing research in this area for over 20 years now, and put out their first publication back in 2002 around threat assessments in schools and what are the important components that we need to have in place in order to make sure that we have a really good threat assessment program and that we are following best practices where it's, where we are helping these individuals onto a much more positive pathway. So in the PowerPoint that I've provided, if you're interested in learning more about this and the research that underlies the approach I'm talking about here today, I've given you direct links to all of these documents, which are free and they are downloadable. One of the things that they did find out, though, is they were doing not only their initial research, which was, over 15 plus years ago for targeted school shootings, but even more recent research, they just put out their newest report in 2019, is while there are many differences to the types of individuals or behaviors that contribute to these acts, there's also some commonalities that they found within their research. And what they found is that in particular school shooters, they don't just snap. They plan out their attacks beforehand. So oftentimes that behavior is observable. And what we mean by that is there's leakage. They are posting concerning things on social media. They are making concerning comments to their friends. They are drawing violent writings and drawings. They are, making comments about how life is never going to get any better. Nobody cares about me. It doesn't matter what I do anymore. I'm never going to measure up. But the challenge we have is individuals didn't always see it for what it was. A lot of times people go, oh, well, they're just having a bad time, or they were just joking around, not realizing that that was leakage, that was potentially an indicator saying that things are not going okay, and they may potentially be planning an act of violence. They also had indicators on that pathway to violence, which I'm going to talk about here in some subsequent slides. In addition, what they found is, especially with school shooters, the K-12 population, they tell people beforehand. So one of my biggest frustrations with the youth of today is it seems like they have no boundaries, right? They just share everything with anybody because of social media. But actually in the threat assessment world, that's a good thing, because when they're telling others or they're showing some of these indicators, it gives us the opportunity to engage and intervene before they get to the point of doing an act of violence. The other important finding, though, that's really held consistent over time is that there is no accurate or useful profile of a school shooter, meaning it is not the color of your skin, your race, your ethnicity, if you're wearing a black hoodie or a trench coat that activates the threat assessment process. It's the behaviors of concern that activate this process, because acts of violence have been done by individuals that did have some significant mental health concerns, were struggling socially, struggling academically, had significant trauma histories, but they've also been done by individuals that were on the football team, elected to the 9th grade homecoming court as the 9th grade prince because they were so well liked, and have come from intact families without significant trauma histories. So that's why we like to say there is no profile. We cannot profile, nor is this a profiling mechanism. What we're looking for is what are those behaviors of concern that tell us that an individual might be planning an attack so we can engage this process and intervene. In addition, a lot of times they were already on multiple radar screens, but one of the challenges we again have is that when you see things in isolation, it may not look like a big deal. But when you start putting the pieces of the puzzle together, and now you have multiple teachers that have noticed changes, you have a couple peers that are coming forward saying, hey, they just did these concerning social media posts. You have a coach that comes forward and says, you know what, I've really seen a change in their performance recently. It seems like something's wrong. when you start putting those pieces together, it oftentimes can paint a very different picture. And that's what this process allows us to do, is to bring those different pieces of the puzzle together to really understand what's going on in an individual's life. What we also know is that many of these individuals had significant difficulty coping with losses or failures and were even suicidal. So this we want to pay very, very close attention to, because this may also end up activating a suicide risk assessment. But honestly, once they get to a point of feeling like nothing is ever going to matter, nobody cares about me, nothing is going to change, no matter what I do, it's not going to get any better, that's what pushes them further along that pathway to violence. And just as we know how to help someone who's suicidal, we also can help someone who's homicidal. As I like to say, suicidal and homicidal ideation are not permanent states of mind, they wax and wane. So that gives us the opportunity to really engage. Now, this last point is an important one, because yes, while bullying has been a significant factor in many of these targeted school attacks, bullying alone does not cause someone to go on to be violent. But when you have been bullied or harassed and you pair that up with other stressors, losses, or failures, it can certainly be a significant contributing factor. So again, bullying alone does not cause violence, but it can be a significant factor when it's paired with other stressors. And so why should schools use this approach? It has been recommended by the Federal Commission on School Safety. It has also been recommended in the Guide for Developing High Quality School Emergency Operations Plans. But what we're also seeing is more and more states are passing laws saying we need to have this process in place because we know that it can save lives. And this is a list of just some of the states that currently have state laws in place. Some are more prescriptive than others. Some are really general. The key, though, for all of these states is really the fidelity of the implementation. Are they doing behavioral threat assessment and management, as I like to say, the right way? And that's what we're here to talk about today. So what do we know about some of the key research findings is that when this process is done with fidelity, and that's the key word there, is when this process is done the right way and utilized appropriately, more of these individuals are likely to receive counseling services and that parent collaboration with the school. They're less likely to receive long-term alternative placements or suspensions or expulsions. So it really helps to mitigate disproportionality within our disciplinary system. And the goal is to use this process to prevent the school to prison pipeline. Again, when used appropriately, this actually mitigates disproportionality and mitigates that school to prison pipeline. Because what is our goal? It's to help this individual onto a much more positive pathway. And in a lot of the cases that I've worked over my career, it's not just that individual that's struggling. Oftentimes there's family stressors. So what this process really allows schools and community agencies to do is to collaborate and partner together for providing those wraparound services, because we know when we can help the family, we can also help their children, which are students within our schools. So again, it really allows us to open up that collaborative approach. So when we talk about what is behavioral threat assessment and management, it is a systematic process that is designed to identify, inquire, assess, and manage. And it is so important that we don't skip steps. And what I often see happen in schools is we go from identify to manage, meaning a student makes a threat, and when this process is not used, boom, they immediately jump to punishment, which is often suspension and expulsion, without working the process first to even determine, number one, is what's being reported even legitimate and factual in the first place. I've worked some threat assessment cases where students have been set up by other students who wanted them expelled from school because of some sort of conflict that was going on, or they wanted to eliminate the competition to make a sports team. So as I like to say, no management decision should ever be made in regards to interventions or potential consequences until you work the process first, assess the situation, figure out what's contributing to some of these dynamics. Is it even legitimate in the first place? And then that's going to guide us into what are those appropriate management decisions to make, with the goal of how do we help them onto a more positive pathway. Now, I've mentioned a couple times the pathway to violence. And this is really what helps us make the distinction between making a threat and posing a threat. As when I teach these workshops in person, I always like to poll my audience and I say, okay, how many of you at some point in time have looked at your children, your spouse, or your significant other and said, I could just kill you? Or you threatened your children if they didn't get out the door fast enough for you to be able to get to school and work on time. I would argue that most of us have probably made a threat or said something that could be interpreted as being a threat, but there really was no intent behind those words or actions. We have a lot of kids in K-12 schools that with underdeveloped frontal lobes that say or do things out of anger, out of frustration. They think they're being funny, not realizing that kind of humor is inappropriate. We have kids on the developmental disability that may not, have skills in the social arena, so they didn't understand how that could be interpreted. We have other kids that mimic what they see others do, again, not realizing what it is that they're saying or doing. Or are they talking about a violent video game? And if you didn't understand the context of the conversation, it could appear to be threatening only to find out that it was not. So we have a lot of individuals, especially with the developmental ages and the populations we work with in schools, that may say or do something that could be interpreted as making a threat. The key, though, is do they pose a threat? Because there's a big distinction between making a threat and posing a threat. Is there true intent and legitimacy behind those words and actions? So how do we know if they pose a threat? And that's where this pathway to violence comes into play. Now, sometimes, but not in all cases, this pathway to violence can start with a grievance. So some sort of a conflict, or they feel like someone has wronged them. So it starts with being disgruntled, okay? If we don't intervene at that point, then it can move to ideation. And they start thinking about wanting to harm someone else, okay? If we don't intervene at that point, then they get into the planning, where they start putting a plan together. And I hate to say it, but you can find anything and everything you want on the internet these days to tell you how to do an act of targeted violence. There's just way too much information accessible to them. And if they're sophisticated enough to know how to get onto the dark web, it's even scarier. If we don't intervene at that point, then we get to preparation and acquisition. This is where they start gathering the means for which they're going to do it, whether it is by firearm, bladed weapon, considering making a bomb. They start refining the method. So they might be going to the shooting range. They might start putting the bomb together. I'm going to go out into the woods and detonate it, see if it worked. If not, I can go back to planning and do more research, then come back up to preparation and acquisition. Or they start looking at how they can get in closest proximity to those individuals they want to harm. So they start looking for those opportunities. So this is where you might see some stalking behaviors, or they start looking at schedules and routines. When is there more supervision, less supervision? When is there the greatest number of individuals gathered at the same time? Then if we don't intervene at that point, then that's where they get to implementation, okay? And this is where they carry it out. But what is so critically important is that at any point in time, we can be successful in intervening before implementation. I've worked many cases where they've been this close to carrying it out. And when we've been able to engage and intervene with this collaborative problem-solving process, we've been able to help them onto a pathway to violence. We build those connections and relationships, and they've gone on to lead healthy and successful lives. So one of the key hallmarks that we're really teaching when we do this training in schools, and even with community threat assessment teams, higher education, workplace threat assessment teams, is there is that difference between making a threat and posing a threat. And if they made a threat, but they don't pose a threat, could we handle that through a problem-solving, conflict resolution, restorative practices approach? If they do legitimately pose a threat, then obviously that management plan needs to be much more intensive and much, much more directive. So again, this process helps us make that distinction. Now, what's also important to understand is what behavioral threat assessment is not. It is not the same as profiling. This is not designed to be adversarial. And I know when parents or some community members hear the term threat assessment, those words are concerning. But this process is not designed to punish or to get someone in trouble or to get them kicked out of school. It is designed to figure out what contributed and how do we help them onto a much more positive pathway. So when we engage our collaborative partners, when we engage the student and the parent in this process, it truly is meant to be a collaborative problem-solving approach. It is not the same as a disciplinary process. So if discipline does need to be handed down because maybe they violated a state law that says there has to be some sort of consequence, as I like to say, it's got to be consequences with care. And the discipline process still needs to be followed. So the threat assessment is not the disciplinary process. It's helping us figure out, number one, is discipline even necessary in the first place? And if we do, what is appropriate and how can we do that in a supportive way? Again, consequences with care. Threat assessment is not a panacea for safe schools, meaning you saw everything else I talked about at the beginning, that this is just one component to a comprehensive approach to a safe schools climate. And also a behavioral threat assessment is not an educational evaluation. It is not a special ed evaluation, and it is not a mental health evaluation. What it is it's a safety assessment. What this team is looking at is, do we have a legitimate threat and a safety risk? What do we need to do to mitigate that risk? And what do we need to do to get that individual help? We are not doing any sort of diagnosing or making any sort of educational placement decisions in this process. It is also not the same as a functional behavioral assessment. That is a specific process that helps us look more, in depth at the function of the behavior. Now, that might be recommended be conducted as part of this process, but the threat assessment itself is not the same as a functional behavioral assessment. Also, a threat assessment is not the same as other types of risk assessments. For example, a suicide risk assessment involves well-trained mental health professionals with a specific set of questions that need to be asked. Yes, a suicide risk assessment and a threat assessment may end up both needing to be done, but we don't want to confuse those two processes because there are specific sets of questions that need to be answered. Then the management plan may need to address both the suicidal and the homicidal ideation. Threat assessments are not to be used for the purpose of exclusion. And I've gotten a couple calls from individuals that say, well, we were told we needed to do a threat assessment so they can expel this student. Absolutely not. If they are using a threat assessment for the purpose of exclusion, that is not being used in the appropriate way. And that is not at all what we advocate for in the threat assessment world. The whole key part is honestly, how do we keep them connected? How do we continue to build skills in those relationships? And it's not used to predict future behavior. What we mean by that is this is at this moment in time. Okay, do we have a risk for safety right now? This is not a predictive model that says 6 weeks or 6 months from now, is this person going to do anything? We're really assessing where are we in this moment in time? How do we mitigate risk and help put those supports in place? So it is an intervention process. It is not designed to be a disciplinary process. Now, how do we know if we're doing this the right way? In schools, the National Threat Assessment Center and the U.S. Secret Service has talked about the importance of you have to build a good program in order to support the threat assessment process. You need to have a good multidisciplinary team. You need to define what are those behaviors that go to the threat assessment team versus what are those behaviors that go to other intervention teams within your building. We do not want to overuse the threat assessment process, nor do we want to use it inappropriately. So it is very much designed for when we're seeing indicators of potential targeted violence, not that we're going to use this process for every type of concern that comes up in schools. We need to have good central reporting mechanisms. If individuals have concerns, how do they bring that information forward in a confidential or anonymous way? We want to have good procedures in place, and we want to develop risk management options. So in the threat assessment world, we use the term management. In schools, we use the term interventions. We're speaking one of the same things. So how do we put good intervention and management plans in place? And again, all of this is embedded within a safe schools climate. The more we're building relationships and connectedness, hopefully you have less individuals that want to go on and do an act of targeted violence. But also you're going to have more individuals willing to come forward when they trust that the adults are going to do this the appropriate way and do it in a way that's going to be helpful. And really having good, high quality training for those individuals that will be serving on these teams, but also good training for our students, our staff, and our parent community on how to report concerns when they see them and how do we bring those concerns forward. So when we talk about some of the evidence-based and evidence-informed models that are out there, there's three main ones in K-12. There is the Secret Service National Threat Assessment Center model. There is this CSTAG model. I'm sorry, I should be CSTAG, and then the Salem-Kaiser Student Threat Assessment System. And really, any one of these is a good evidence-based, evidence-informed model. They do approach it a little bit differently, but the bottom line is they are all designed for that multidisciplinary team process and really engaging those interventions and supports. And what any good threat assessment procedure should have, and this one is based on guidance from the Secret Service and the U.S. Department of Ed, is that when we get a report, okay, we want to screen that report. Okay, we're going to engage our threat assessment team, and do we need to do a full assessment or not? If we do, what we like to say, multi-method, multi-source. Again, we want to collect all those dots so we can connect all those dots and determine, do they pose a threat? And the Secret Service has 11 questions or themes that we look for. And is this more predatory violence or is it more reactive violence? And then we make that assessment. Do they pose a harm to self or others? Do they need supports? And if so, let's get that good management plan in place. And for as long as needed. And we're going to progress monitor. And are they responding to that management plan? Are we building skills? Do we need to tweak that plan at all? With the eventual goal that if we can go back and say, no, they no longer pose a threat of harm to self, others, or both, and they no longer need a structured plan, or again, our tier 1 universal supports are enough. The goal is that we can eventually close the case or place it in an active status. In other words, we've helped them onto a much more positive pathway. And when we talk about, again, really to me, the critical importance of this approach is it very much is on that management part. Again, that the management part is what we like to say is more of an art. We're going to customize it. We're going to individualize it. If needed, we're going to help engage supports for the family. And what we also can do to help escalate grievances is this process gives them a voice. It allows them to be heard. And so we can identify what are some of the stressors or the struggles that maybe they have been facing. We also have to be careful that with management, we don't overly use suspension and expulsion because distancing makes engagement more difficult. So there's a lot of pressure from parents these days to kick kids out. I don't want my kid to go to school with someone who just made a threat. What they don't realize is that once you disconnect them, you actually are escalating risk. We've now lost the opportunity to stay involved, to stay engaged, and to build replacement skills. So I know it seems kind of counterintuitive, but honestly, when you put the right supports, protections, monitoring, and supervision in place, the best thing that we can do is find a way to keep them engaged. And that personalities do matter. Who is it that we can engage that they're more likely to respond to? So when we look at, some of these supports, it's, the person of concern or the situation of concern, what can we do? But are there also some other stressors that are going on that we can engage some of what I would say those wraparound services? Then also, do we need to increase supervision and monitoring? But all of this done within the auspice of how do we continue to build connections and relationships? So again, as I like to say, punishment alone does not change behavior. When we look at the interventions and supports, there's so much more here that we need to be looking at. We really need to look at this more from that systemic perspective. The other important part is there's so much misinformation out there, is there are groups that are saying threat assessment contributes to the school to prison pipeline. Threat assessment contributes to disproportionality. threat assessment is violating due process, individual rights, or IDEA. Threat assessment means that we're sharing confidential information and we're violating privacy. Absolutely not. If threat assessment is used in the right way, it actually protects against disproportionality. We are only sharing information that is critical in order to make sure that that individual and other individuals are going to be safe. And if it's being done in the right way, we are not violating due process, individual rights, or IDEA. This process can very much be done in a way that respects all of that. And in schools, when we know there's a safety concern, we need to engage. We have an obligation to address that safety concern. But again, this process should not be used for punishment, and it should not be used for expulsion. It's very much to be used for interventions and supports. Now, what do we know, though, is, again, it really boils down to the fidelity of implementation. Again, good quality training and making sure that this is being done in the right way is what helps to mitigate the concerns that are listed on this slide. Now, real quickly, just for the last couple minutes, because I want to make sure we have a little bit of time for some Q&A, is unfortunately, the realities are you could do this process perfectly and an act of violence could still happen. Or our school and communities can face other types of crises. So what is so important is, how do we help prevent and mitigate where we can? Again, if we're doing a really good job in our prevention programs of teaching social emotional learning skills, and we're building these skills on the front end, then we're building skills where individuals don't want to harm each other because people care about each other and we feel connected. And we have the skill sets to make good, responsible decisions, have good self-awareness, self-management, social awareness, and those relationship skills. And what we know is that emotions matter for so much of what we do. So whether schools are calling it social emotional learning, positive behavior supports, they have some other initiatives going on. The bottom line is, when we teach those social emotional learning skills, our schools and our communities are going to be safer. And unfortunately, just like BTM, social emotional learning has gotten a lot of negative press because people don't understand what it really is. And what we know is, when we focus on the social emotional learning, again, it boosts academic achievement, healthy well-being. It helps build those connectedness and relationships because we understand differences and perspectives and we embrace differences and perspectives. And it really helps to establish that positive school climate. And then just lastly, and again, you've got a link to this curriculum, but this is the Prepare School Crisis Prevention and Intervention curriculum. And what we really teach within this curriculum, and again, it's designed for school districts, but we also encourage our community providers to attend, is it starts with prevention. We need to make sure that we are reaffirming physical health and perceptions of safety and security. We're meeting Maslow's hierarchy at those lower levels. But when a crisis happens, how do we evaluate and provide and respond based upon demonstrated need? And then how do we evaluate the effectiveness? So when we talk about coming at crisis response through the Prepare lens, we're not just opening up a big room and sending everybody down the hall that may need help. We're doing psychological triage first. What is the impact and who needs what? And then we're basing those interventions upon demonstrated need. And if we see delayed responses or we see needs emerging that maybe we didn't catch in the first round of interventions, then we can get in there and be more directive, or we can also collaborate with our community partners. So again, you've got resources to learn a little bit more about this, as I want to leave some time for some Q&A, but you can see through the Prepare model, it's not just one type of intervention. We do crisis response according to a multi-tiered approach and really based upon demonstrated need, with the basis of really fostering those social connectedness and making sure that we've got the engagement of our leadership and that we're really attending to the physical and the psychological needs of recovery. So the important part here is, again, we need to make sure that we're engaging in culturally responsive practices. We know that we can prevent school violence We know that focusing on school climate and community climate and culture is the best prevention and mitigation tool, but it also facilitates recovery when we have a tragedy that impacts our community. But it really boils down to high quality training and making sure that we're putting protocols in place that are holding people accountable for really doing the implementation the right way, where we're helping them onto a more positive pathway. And then in the slides, again, you're going to have these within the PowerPoint. I've just given you some links to some really, really good resources if you're interested in learning a little bit more. So I'm going to go ahead and pause there. And so we have a little bit of time for some Q&A. I know that was a lot of information in a short amount of time.
That was amazing information, Dr. Reeves. Thank you so much. If there are any questions, remember you can ask a question by raising your hand, or if you are calling in, you can push 9. While we're waiting for people to see if they have questions, I have questions. I was curious about, you said that some states have state laws in place for school threat assessment.
Mhm.
What does that look like? What does that mean exactly?
Well, it's all over the board. We've seen some states pass laws that say you need to have threat assessment teams in schools and they need to be trained. And literally the law is that vague. They don't provide any other guidance. There are other states that have laws passed that have integrated best practices that, for example, require a multidisciplinary threat assessment team, and they spell out who are at minimum the critical members of those teams, the importance of community engagement, community partnership engagement, the appropriate engagement of law enforcement. So there's some state laws that have been much more prescriptive about making sure that threat assessment teams are utilizing best practices, not just you have to have this process in place and leaving it at that. There's also some states that have protected the records, of threat assessment records and so forth. And so, which is important because again, the confidentiality of this process is real critical. So I've seen it all over the board, from very vague, which kind of leaves a lot open to interpretation, and in my opinion, can lead to a lot of misuse of the process, versus state laws that really help provide additional guidance on how to do it the right way with good fidelity according to best practices.
Is there any sense that having the laws in place actually help to prevent?
You mean prevent acts of targeted violence themselves?
Yes.
Yeah, so we know it works. So here's the challenge when it comes to the data collection. There is no national database collecting data of how many acts are prevented. But I can tell you from some of the research that's been done in the threat assessment world, and for those of us that have been doing this process for a long time, as I say, how do you know you prevented an act? It's when something didn't happen. And we know through our own experience and through some of the research that is out there that when you engage supports, you prevent an individual or mitigate an individual from getting all the way to implementation. But I wish we had a national database. Now, there is a website called Averted School Violence, AVS, Averted School Violence. You do have to register for it. But they have cases where people have input cases. They've taken away, all the identifying information, and they have shared how this process has actually prevented acts from occurring. So there is some qualitative work out there that provides case studies of how this has prevented, things from happening.
It looks like we do have some hands raised. It's hard for me to see, so I don't know if someone from the OAC can.
Sure, I'm happy to help, Commissioner Bunch. I think the first participant with their hand up is calling in with a phone number that starts with 916 and ends in 718. You can go ahead and unmute.
Thank you. This is Steve Leone. I've been part of various meetings of the OAC for a very long time. And thank you for letting me speak here. I came into this reading material and it felt a little too mechanical to me, but hearing the presenter, I am more of a fan than I was before, and especially her cautions about not skipping steps. But I want to emphasize that even if you do all the steps, you need to do the steps with humanity and compassion rather than mechanically. If that is not understood, even if all the steps are there, it's possible to go through all the steps and still be kind of mechanical, and that's not going to work. I mean, I was a volunteer, more of a peer counselor for 25 years at one point, and you know, the relationship, the interpersonal relationship, paramount when you're talking about things like this or anything like this in mental health. I really want to make that point. And I also wanted to make the point that this is not for today, but I would like to hear from actual students. And this is not necessarily just to say, well, the students should be involved. I am saying I want to hear from them as participants in what happens in a school, in what happens. I mean, I actually heard one of your members from the earlier commission, or rather committee meeting, actually say, are we actually scaring our kids? You know, I mean, so if this is not handled very, very delicately, causing more harm than good, you know, in terms of saying something happened, we have to be prepared for it, kind of thing. So I'm hoping to hear from those kinds of kids, and I just spaced out the last part of what I was going to say, so I'll just end it right there. If I have a chance to speak up later, maybe I can. Thank you.
Thank you, Steve, for those comments.
Sharon, sorry, but before you move on to the next person, can you ask them to take down the slides? Perfect, thank you. There.
I think Sharon Yates, your hand was up next. Oh, you're still muted.
Okay. Can you hear me now?
Yes.
Okay, I have a question. I'm curious as to whether your program addresses poverty and overcrowded conditions. I find that, you know, those two social detriments can really attribute to other problems. Do you address those issues?
Great question. Not directly, but when we do look at some of these systemic inequities that we know have been prevalent in many of our systems for a long time, certainly that can increase stressors. And we also know that many of those communities also don't have as many supports to be more preventative and proactive. So that's why, you know, we like to say this process, it has to be embedded within more of a systemic approach. And that if we're going to prevent violence, it's more than just this. We've got to really look at what are some of those systemic contributing factors also. So excellent point.
Thank you.
And then the only other hand I see is Michelle Custer.
Hi there. So I wanted to take a moment to chime in on the question about whether there's any evidence around legislative efforts being impactful in terms of prevention and or implementation. And so I am actually one of the panelists today. So I'm a school psychologist in Northern California, and I have been working independently for some years on legislation in California, and with the assistance of Melissa, Dr. Reeves, as well as various other stakeholders and participants. And so I just want to share that my impetus for doing this was coming from out of state, from the East Coast to California, and working in numerous different school settings, from districts to charters to private school settings, and really seeing quite a level of concern over the lack of guidance and the lack of procedures and policies at individual schools systems. And so at the time, it was right when Assembly Bill 2246, the Suicide Prevention Intervention, was being enacted. And similarly, you know, working in the schools in California a few years prior to that law, seeing that when the law was enacted, more than just guidelines, there really was a community approach to training and to developing procedures that were well thought out, well designed, with the intentions of intervention at the heart. And so this is exactly why, having worked in states that had more vibrant and vigorous supports in place around conducting threat assessments, I really felt that the need to try to move this forward in California. And that is how I landed as the legislative chair for our state association, CASP. So while there may not be research that's looking at the impact of legislation just from somebody who's working in the field, and knowing that schools have many initiatives and many priorities, but whenever something becomes a mandate, that really adds grit to the focus. And this is a preventative approach that is very, very important.
Do you see that happening in California as far as it becoming a mandate?
Well, that I wish I had a crystal ball. You know, what I can say, and I feel comfortable saying this on behalf of our state association as well, is that there is a new bill that has been passed, SB 906, and we are wanting to provide some guidance for schools on what the best practices are around responding to threats of violence. So while SB 906 has some really great components to informing families about safe storage of firearms, it also speaks to the need to alert law enforcement when threats have been made. And as Melissa did a fantastic job in explaining, we need to make more informed referrals only when it is necessary. And those responding are best suited if they are already a part of a multidisciplinary team that has trained together with the lens of cultural competency, and it is a team approach to not reacting or responding, but to intervening and to getting the student involved, linked up in the community they are in with services, not just at that moment in time, but over time and for a period of time. Because as we know, if somebody really is presenting or posing a risk, that risk is not going to potentially go away right away. And there are different things that can escalate those behaviors down the road.
Thank you. I don't know, Melissa, do you see any other hands?
Steve, do you have one other comment?
Yes, thank you. I remembered the part I couldn't think of at the moment just before.
Great, go ahead.
Okay. I should mention I am, in addition to all of my work in the past, I am a member of the California Behavioral Health Planning Council, and we just had our meeting, our big 4-day meeting quarterly last week. One of the presentations we have, what I would like to relay a piece of that I think has relevance here. And there was a guy talking about being on a ward of a hospital. Now, this was with an adult, but I still think it has relevance. And the guy had been assaultive of the staff in the ward, and he was there trying to problem solve some. And the guy said, "Well, let's bring the guy out." And they said, "No, he's assaultive." So they said, "Bring him out." So they brought the guy out, and it transpired that he said, "What do you want?" And he says, "I want some soap." "What kind of soap?" "I kind of like Irish Spring." So he left, and the people on the ward said, "Where are you going?" He said, "I'm going out to get some Irish Spring." So we went to a local store, bought the soap, brought it back, and said, "Give it to him whenever he needs it." And the guy said, "It's been a long time since someone asked me what I needed or what I wanted." And evidently, it's not about the soap, it's about the fact that he having no effect saying anything about what he needed or wanted. And he was on the ward, from what I understand, another 9 months and never assaulted anyone again. And I think the lesson here is it should be psychology 101, but as you can see, even the people working on the ward were not practicing it. And that is that if you deny a person their agency or they have no agency, as our presenter had said, like going to hell and I can't stop it, I can't change anything. So I think making sure the kid feels that they have some agency even in the process as this is implemented. So very critical. Thank you.
Thank you, Steve. I do see that Chair Madrigal-Wise's hand is up.
Yes, thank you. I just wanted to make a couple of comments. First, I'd like to thank the presenter, Dr. Reeves, for this excellent presentation. And I appreciate what you kept saying. I too am a big believer that if we create those school communities where the students feel that there are adults that care about them, where they feel connected to that school community, where there's compassion and care across the school community, then they're going to feel that sense of safety, and where they're connected, they're going to feel safe and want to be there, and so and not cause harm, right? But I think it's also critically important that you said we not skip steps, and that is where I see the system fail. So my day job is I work at the San Diego County Office of Education. We provide prepare trainings. We also provide threat assessment, and those that are providing it are also trained in trauma-informed, the trauma-informed approach. So it's about doing it, approaching every student, no matter what the threat is, no matter what the concern is, from that trauma-informed lens. And so, when you mentioned, Michelle, about AB 2246, and then now AB 1767, which is about comprehensive suicide policies and procedures around that, we also know that the research states that many of the school shooters had suicidal ideation even up to a year prior to the school shooting. And so the questions that law states that we have to report, or the numbers that we have to report to the CDE, for example, are, who was suspended, who was expelled, those kinds of things, were weapons brought on. And yet we know the research shows that these children had suicidal ideation and were not even asked to report those kinds of things. And so we are now tracking, suicidal ideation through suicide risk assessments. Risk screenings, not assessments, just the risk screenings, right? So we're using the Columbia, and to us, that's important because we're going to look at trends. We're going to look at what is going on and really, truly, use that data to inform practices to see what's going on. Is it cohort data? What's happening? Because I think that's important. So we put our funds, our efforts, our programming around that. A lot of times what I see is we just kind of throw things at the wall to see what sticks, and we're not even looking at the data. And so we're trying to do things differently, and we have to do things differently because children are dying and children are being hurt, and we're having these negative consequences. So I appreciate everything you said, and you're absolutely right. When we skip steps, that's when we fail. We fail our students, we fail, our schools, we fail our communities. And I think that there's a lot of pressure. There's a lot of pressure because people are scared. Our families are scared, our parents are scared, and our students are scared. So there's a lot of pressure to do something. And I just wanted to add one more thing. And everything that we talked about today, including the prepare model and the risk assessments, I just want to add this. There's a lot of pressure on the adults in our school campuses, and I think we need to really continue to talk about supporting them, because we can talk about everything that our students are going through, but our educators are taxed. and they're not going to be looking out for the warning signs or feel very compassionate towards their students until we're really taking care of them and working on their mental health too. So it's got to be the and so what I appreciate about what the commission is doing right is we're talking about things about workplace mental health. And so that's where I see that, we're starting to come together in all aspects. And so I just wanted to add that. So if you haven't looked at the wait, I have it right here. The Working Well report, where we talk about mental health standards in the workplace. I think we need to keep having these conversations, holistically about where people live, work, play, right? So thank you. Just wanted to make that statement.
Thank you so much, Chair. I do see that Michelle's hand is up, but we also are running a little late on time. So I don't know if you want to save your response for within the panel, if that's okay. Okay. Thank you so much, Dr. Reeves. Now we're going to move on to our panel discussion. We have 3 panelists joining us today. Please forgive me if I say your name incorrectly. Michelle Custer is a licensed educational psychologist and chair of the California Association of School Psychologists Legislative and Advocacy Committee, and an adjunct faculty member at Sacramento State. She's been practicing school psychology for over 15 years, and she currently co-chairs the CAS membership committee. Jace Kaldunsky is a senior at El Dorado High School and has been involved in school leadership for all 4 years of high school. He's a student representative for EDHS and participates on the peer council, acting as a peer advisor. Jerry Wernley is an officer in the City of Roseville Police Department, as well as a school resource officer at West Park High School and an expert in school threat assessment and threat management. Thank you all so much for joining us today. We appreciate your participation and your expertise, and we're looking forward to hearing your thoughts. So I believe you guys were all given the questions in advance, but everyone doesn't have them. So I'm going to go ahead and state the first question that we would like the panel to discuss. What is your experience, either working in schools or with schools, with assessing threats and connecting students with needed services and supports? What's worked well in your experience? What's been challenging?
So I'm not sure if you want us to raise our hands to answer, but I will go ahead and just get us started with the conversation, and then I think probably Jerry and I think this one's directed at Jerry and I. So I already mentioned briefly, I have been working in California for the last 10 years. I have worked in 2 rather, probably medium large school districts. I worked in a continuation high school when I first started here and working in California. And then I went to an agency for a period of time to just support my family's needs. And during that time, I worked in a lot of charter schools, as well as supporting other local districts in Sacramento, Placer, and El Dorado counties, and even up into Paradise. So that being said, I have been in a lot of schools, and I have had a lot of experience with what's working well and and barriers. And I will say that my experiences with what has worked well they did not happen in California, if I'm being frank. So what I can tell you is helpful is whenever there are policies and procedures that have been adopted by school boards that are informed by the stakeholders who are involved in conducting threat assessments, and when those resources are part of the tools for creating positive school climates, and it is a tool that it has many facets to it. Just in terms of even parents and teachers and students and community members knowing what to report, or when to report something, how to report something. You know, that I did a survey, an informal survey a few years back of school psychologists in California. And that was one of the questions that stood out the most to me, is that there isn't necessarily good guidance for our stakeholders on what to report and when to report and how to report threats. And so that is, I think, a really important piece. Also, what works well and what is important is whenever the relationships with our stakeholders, our law enforcement community based organizations, when those relationships are pre-established, because this is not a K-12 issue, this is a community issue. And we know that you know, resources available for interventions are not, we don't house all of those resources within our school system. And so we really need to have the structure and the framework for the multiple stakeholders to work together, especially when we are dealing with cases that rise to a high level of risk. I could go on, but I'm really curious to hear what Jerry has to say, since he is very involved in this work right now.
Yeah, thank you, Michelle. I got to be honest. I'm quite frankly, I'm surprised that California doesn't have a law that has some sort of mandate regarding threat assessment in schools. It baffles me that there's not at least some sort of guidance or at least some sort of law that has some sort of guidance. It blows my mind as advanced as our state is with a lot of stuff. It seemed kind of odd to me that we don't have it. But I have a lot of experience. I've been in the schools for a while now, and I have quite a bit of experience, you know, working with, like, well, last year specifically. So it's been a culmination of several years. Last year, I helped stand up a behavioral threat assessment program and training within our school district. So the school district I'm part of is a high school district only. It doesn't do K-8 or anything like that. However, within that district, there's probably 12,000 students or something like that. And we were able to stand up a program. Actually, ironically enough, it was helped facilitated through Sigma. They're actually the ones that came out and helped us start the program, train the program, get everything up and running. And so prior to that, I was just doing stuff on the fly as best as I possibly could in working with the staff members that I work with. And you kind of touched on it a little bit earlier too. It's like, it's the relationships that you have to build and the processes that you have to build. So we had the relationships, you know, I ironically enough, when I first went into the schools, there was no process for threat assessment at all. And that really irked me as a person who takes safety pretty seriously. So I started to come up with my own processes, and I said, hey, I started emailing teachers. If you see weird things, let me know so I can at least bring it to a group of people so we can start talking about it and seeing if it's actually something that we need to be concerned of an act of violence, or how we can, you know, best help the kids and help the situation. And then eventually we got the process, and it's been great having those processes, but having those relationships and all that stuff. And you talked also about the challenging part, right? For me, the underreporting has been a challenge. I handled a pretty serious threat last year, where it would have made a lot of news really, really big. And kids knew about it 2 months in advance. Nobody said anything. And I confronted them on that. And it's like, why didn't you say something? And they're like, well, we just didn't think it was a big deal. And there was the leakage that Dr. Reeves talked about. There was all the stuff that you would see classically. And it's like the fact that it's underreported. Now, having said all that, we do have a fairly robust system in place at our district. We've got, you know, some anonymous reporting, you know, software and that people can use either online, or the other thing that we have is, like, we've also made little stickers out yay big that have a QR code, and we started putting them in all the bathrooms in the high school. So that way, if somebody wants to see something, they can say something, they can just scan that in a place where they're in a private area. So they're not having to see it like it may be out and about in a more public area. So we're trying to get those as many as we can. And I personally am of the thought is like, I would prefer to have over reporting than under reporting. And I prefer to chase ghosts than the actual, be on the news for the wrong reason. It's like, we have to make sure that the school is safe.
Jerry, I'd really like to piggyback on one of the things that you just said and Melissa brought up in her presentation as well, and that is the code of silence. And so when we talk about the need to have positive school climates and those relationships between students and teachers and a place of belonging, a big piece of that is in the security of knowing that if you make a report, that it will be handled with sensitivity and integrity. And I think, now I'm on the side where I'm a parent of a child going into high school, and there is very much knee-jerk reactions from our parents whenever it becomes known that somebody made a threat. And I think one of the really important ways to set up schools for success is to have guidance about what happens, how threats are handled, and what the intent is behind our response and management. And so, I see Jace in this conversation. I see him nodding his head, and I really think that positive school climate is what is going to set up the likelihood of people coming forward and feeling a sense of trust and security about how the threat may be handled.
Yeah, and for us, we try to brand it as the culture of concern, so that way if people are concerned about something, they can bring it forward. And just because you say something doesn't mean that somebody's getting in trouble. It's like, and when I talk to the various kids or anybody involved in it, I really try to explain to them, it's like, we're here to help people. It's not, I'm not here to put somebody in jail. Now, jail might be the thing that helps the totality of the campus at that moment. But in the grand scheme of things, like the case I was talking about earlier, I go out and visit that kid routinely to keep checking in to make sure that they're doing okay. They're not at our campus anymore, but they're still my responsibility to help them be a successful person.
I wanted to give Jace, sorry about that. I wanted to give Jace an opportunity.
Yeah, for sure.
Share if you'd like to. Thank you.
Hi, yeah. So you mentioned I'm a part of a peer council program in our county. That is one of my favorite programs that I work with. I've been doing it 5 years now. And with that, we have at-risk youth come in who have been cited through, it's a collaboration between probation and county health and human services. And it's really beneficial because our whole thing is, we're not here to get you in trouble. We're not here to discipline you. And the first thing we tell them, we're here to help you. And that is not often, it's interesting. Students come into the program and they have this mindset of, oh my gosh, I'm in trouble. I did this bad thing. I'm here at the probation office to talk to 5 random other high schoolers. This is weird. But just seeing their reaction on their faces of oh, they're not here to yell at me and get me in trouble and have me do community service or whatever it is, which sometimes we do it, but it's not okay, you did this is exactly what you do. As your reformation, it's unique to the individual. We talk to them about what happened and why this incident happened, but we also get to know them holistically as a person, and then we're able to find out what supports we can use to set them up. Which I've been able to see on my campus. We have a phenomenal admin team, and I love them. They're a hoot. But they're really good at not just, their job isn't just disciplining students, it's getting to know them, finding ways that they can connect with them outside of just, oh, a teacher referred you to my office again, we're going to talk about why you're in trouble, and don't do that. And it's great to see their connections, even with the frequent flyers that they see. Then it's totally a different scenario when they see them in the hallways and they're out at lunchtime and talking to them. It's still positive connections that they're getting.
Thank you, Jace. I'm sorry, Michelle, I think I cut you off. Did you want to?
Oh, no, that's okay. I'm so glad that Jace had an opportunity to share, because it's programs such as the one that his school has fostered that have peers reaching out and connecting with peers to look at supportive interventions that really make a difference. And those restorative opportunities. But getting back to what Jerry was saying, you know, the code of silence is not just with students. One of the events in my career that again kind of pushed me towards moving, trying to promote legislation was a situation where I went to administration and said, I am mid-assessment with this kiddo, and there are some very real concerns there. He has access to a lot of weapons. There is a trauma history. Mom is telling me that she is afraid for that she has safety concerns. I think we need to call law enforcement and have them do, you know, get them involved. And the administrator was very concerned about that, opening up that door. And then when the law enforcement officer came, he's like, well, you're the psychologist, this is your issue. And so, you know, and again, this was a few years back, but it is that working in silos, and it is not necessarily an uncommon response for somebody that doesn't have the training on how to work collaboratively in a team to you know, point fingers. So I think the point that I'm making is that this isn't something that, this is nuanced. And like Melissa said, there is an art form. And as one of our callers who called in said, there is this empathy and relational component to this. And knowing several school resource officers throughout my career, when it comes to the topic of the school to prison pipeline, those SROs who are a part of the school community would go to bat for every student that they got involved with. And even I recently had the chance to get training as a mental health professional through the FBI's behavioral analysis unit in Quantico. And over that 2-day training, it was the message that was constantly coming was that we need to support these individuals through intervention throughout the lifespan. And so I think that there is an opportunity here to reframe that how powerful tools such as this are, because we have communities coming together as a safety net to provide wraparound services. And again, going beyond K-12.
Thank you. Let's move on to the second panel question. What have been effective long-term responses by schools and school partners once a student at risk has been identified, and how are families and caretakers involved?
So again, I think this is me and Jerry. Jerry, do you want to start?
Yeah, so in my experiences, we try and involve everybody as early as possible. And whether that be the caretaker or the family members, because it's like, we're not going to solve this problem just by ourselves. And additionally, we have the benefit in our city of having a family mobile team, which is a licensed mental health professional that works within our police department that has access to like county resources. So we get them connected as quickly as possible and try and bring them into the fray of like trying to figure out what's going to work best for in the long term, including our counselors on campus. And it's like we try and check-ins. I mean, there's so many different things. It's like the check-in, check-outs. Those have been very effective for kids that I've had very, very strong concerns with. And we've, like in one in particular, we set up like a number scale for that kid, so that way they could say, hey, how they're feeling each day. And because they're also, you know, going through medication changes. And it's like, and if that kid got to a certain elevated number, we'd be like, okay, maybe, sitting down in the counseling office is better than being in a classroom where they're maybe going to get more elevated. They're still going to get the educational experience. It's just a matter of trying to help them deal with, what's going on in their mind and have them figure out better solutions than, reverting to violence or something like that. So that's been what's helpful for us.
I think this is a great place too to really look at establishing that cultural broker. We live in a very diverse state, and as this panel and committee is well informed of, there is a lot of disproportionality in terms of referrals and disciplinary practices for people of color, as well as our students who have disabilities. And so, it's important that we have families involved from the get-go, and that our teams have an understanding of what is norms within the culture, what may look like threatening behavior to us may be a very protective behavior in that person's life. And so the families need to help inform us in terms of what that individual's child's risk factors are, as well as their protective factors. And then we need to use that information to continue to, build up the protective factors. I think that, something that is not necessarily known to a lot of families are the traps of social media and radicalization, and that some of our students with disabilities are very vulnerable to becoming part of a community where there are bad actors who are going to manipulate those students or those people into engaging in some very dangerous things. And that is a trend that is starting to become seen throughout the country. And so we have a responsibility to inform parents as well about things to be looking out for once a student has become known to us. And so some of that is psychoeducation and being a support for the family, to help support their child.
I do want to give Jason an opportunity to respond if you know of any programs that you feel like you've seen at your school.
Yeah, so our school I sit on our site council, and so I get to listen in on all these bits too. In our school, it's where we're focusing on is also you're not just contacting parents and caregivers with the negatives, but also with the positives. And that's a big thing that we're focusing on, because especially with your more at-risk youth, parents and caregivers are constantly getting those calls. Oh, they're in my office again. XYZ happened. But then, so one of the schools in our district, I actually got to hear from at one of our board meetings there. We implemented in our district Dean of Student Services. And so the dean of one of the other high schools in our district has shared out that this was something they implemented where when a student can get a negative referral or a positive referral from a teacher. And so it's the same referral process, but it's for whichever. And so when it's a positive, they're still called into the office, and then they have the opportunity to get like a shirt, a candy, or a phone call home. And the dean was saying a majority of his students who are more at risk choose that call home over like free swag or a candy bar, because that never happens. And these are behaviors that aren't just, this isn't like, usually with your more at-risk youth, it's not a behavior that's new. This is something that's been going on for a while now. And so parents are used to these behavioral patterns that aren't being changed just by being sent to the office. So by getting those positive calls home and those positive referrals, it's also really good for the dean. Dr. Reeves, you were talking earlier about like staff support as well. That is a great way for your disciplinary staff to also have those positive things within their own day. So it's not just, I'm doing all this mean stuff like disciplinary things all day, but it also gives them a boost as well and forms a stronger connection with them and the students.
Thank you, Jace. And just before we move to the next question, I want to put out there that I would love to speak with you about this more, Michelle, because I supervised our school threat assessment and response team for LA County, and I was one of 3 supervisors for 2 pretty large service areas. And so often it felt like once we got past the prevention, we were just carrying a caseload of kids, and it just kind of felt like we were waiting for the next thing to happen and waiting for the next shoe to drop. So I would love to talk to you more about your ideas around that and what really the intervention part looks like. But we don't have time now, so I will definitely reach out to you. The next question for the panel was, how can school climate be improved, especially in ways that reduce feelings of isolation among students? And how could school climate help or harm efforts to identify at-risk students?
I really feel like we touched on this, and that Jace, what is like the poster child for the strategies that are boosting positive school climate. I mean, holy smokes, you stole the show, Jace. But yeah, the MTSS, the multi-tier systems of supports, and within that, there's a plethora of research out there about positive behavior interventions and supports, PBIS strategies, that, just as Chase is saying, where not only is the teaching of behavior expectations explicit, but there is all these levels of shifting the ratio of correction to positive reinforcement, or negative interactions to positive interactions. And it is strategies such as that do cause people to feel that school is good. And I love how Jay said that our adults need to shift that ratio as well. And especially in this time where, many are leaving our profession, and at a time when students are more and more in need, coming off of the pandemic, of having a sense of safety and security and belonging, those primary needs. So, and then on the converse, again, getting back to that code of silence, whenever schools are utilizing zero tolerance strategies, which I am here to tell you, unfortunately, this is still occurring in our schools. I think sometimes what is left out of the conversation is some of our smaller rural schools that don't have a lot of resources available, and or the opportunity to have various highly trained and qualified professionals. And so I think in systems that are very reactive and punitive, that is an enormous barrier for establishing trust. And we know that the information that we get is from our community members. So.
Yeah, I'd agree that there's it's hard to know that a kid is having a hard time if we don't get that information. Some of the kids we deal with, we just don't know that they're having that issue until all of a sudden, bam, it's on your radar. And it might, at that point, we hope that it's not too late. We hope that we can still help them and facilitate something, so it's not something that law enforcement has to react to, like have some sort of severe reaction. It's like, but it's like, how do you change that? And we keep trying to push like the positive reinforcement, a lot of the positive reinforcement, but also just sharing with the community, like, hey, this is who we are. We need to know if you're having struggles at home. And in our particular high school, we have a fairly high Asian population, and they have a tendency to be more reserved. So it's hard sometimes to get some of that information from them. So it's like kind of breaking that barrier that's just kind of naturally occurring, regardless of who the student is. We just want to be able to help them and get them to a more positive place. It's like, it's hard for us to know that if there's something that's going on at home, we just never know about those things going on at home, and then it bleeds over to the high school.
And that's a good point, because you were talking about how like people, you don't know, and students who are naturally more reserved, and I see this a lot with at-risk youth, they have a mentality that, oh, well, I'm just in high school, I'm going to be gone in 4 years, no one cares about me, whatever, just like this super, like these walls that they've put up for a reason, whether it's family life, past trauma, whatever their story is, it's caused them to put these walls up. And it's a matter of changing their mindset to that we are here to help you. And our school, we just had a great seminar for our underclassmen called the Day of Understanding with the presenter Keith Hawkins. And afterwards, we were in these breakout groups. I was one of the facilitators, and I had 10 to 12 underclassmen. And there was some that were talking, and they were just so apathetic of like, well, it doesn't matter. They like weren't participating in the conversation. Like, well, why do you think students aren't participating? And I'm like asking them these questions, and their answers were just, well, no one cares. No one cares. I'm just here, and then they're going to leave. I just get to go up. Doesn't matter if I'm not paying attention in class. Like, no one cares about me. And I was like, oh my gosh, it was driving me crazy. I'm like, if we didn't care about you, we wouldn't be here spending thousands of dollars putting into this and dragging all these other students out of class for 3 days to help you. And so a big piece, it's a mindset, not just of students that people are there to help you, but also of teachers that you can make those connections with all youth. It's not just, I am here to teach you, you are here to learn, listen to me lecture and absorb all this knowledge. Like it's making those connections with students so you can tell when something is going on, if something triggered something. And it was interesting in the SILT meeting we had, all the teachers were asking like, well, tell us if they're McKinney-Vento, tell us if they're at risk, like tell us all the things. And really it's not about them knowing who's at risk, who doesn't have what, but those connections should be made with all students regardless, not just if they are XYZ certain criteria in a minority group, have some family problems at home. It should be across the board. Everyone gets that support. It's like one of your tier 1 supports right there. It's like, just you make those connections off the bat.
Thank you. The next question for the panel is, what is the role of law enforcement in assessing and responding to threatening behavior? And how can we ensure that law enforcement involvement does not perpetuate the school to prison pipeline, especially for students of color?
Well, since I'm the one in law enforcement, I could probably help answer that pretty clearly. In our particular format, and the way I believe is that law enforcement should be in the model of behavioral threat assessment. Like we should be at the very, very root of it. It's not so we can get people in trouble. I'll tell you that another anecdote. Last high school year, so the 21-22 school year, I arrested one kid. And that was because I had to. It was one of those situations where my hand was forced and there was nothing else I could do given the circumstances. So where I'm going with that is that the more that law enforcement and SROs can be involved in that, the more we can divert those incidences and avoid even arrest. There may still be reports, or still may be consequences. We understand all that stuff. It doesn't necessarily mean that somebody has to leave the campus in handcuffs, because it's like that can have a pretty detrimental effect on people, whether it be social, emotional. They really can affect them. And it's like that to me is such a vital role of us being like a collaborative partner. And what I have found in my role as an SRO, sometimes people are not in the same boat as you. They don't necessarily believe that you're there to help. There's this perception a lot of times that you're there just to arrest people or you take people to jail. And it's like, in the grand scheme of things, that's not what I'm there for. I am there to make the campus safe and I'm there to help people. Like that, I genuinely want to help people and be as successful as possible. And I would say all of my comrades that I work with feel the same way. It's just sometimes those barriers exist, that are perception barriers, right? It's very easy for law enforcement to say, oh, well, educators are this way. And then educators can say, well, law enforcement's that way. And the reality is we're all working together to make the community a better place and make it a safer place.
And Jerry, thank you so much. I think you are so on point. From a logistical point of view, there are also things that you can do that we in education cannot do. So part of the new legislation is to look at the gun registry and to find out if there are weapons in the home. That's something that we as educators cannot do. There are tools that you have that can help search social media that we do not have at our disposal. There is knowledge of domestic incidences that may have happened in the home that, again, we don't necessarily know. So there really is, in terms of that threat assessment piece and the gathering the dots or the pieces of the puzzle. And again, Melissa, touched on this, and I think it depends on the structure of the teams, but very often law enforcement would only get involved in threat cases that are of a higher threshold. And so, in those cases, it's vital to have law enforcement involved. And while, I think there is the optimism that everybody's intentions are as noble and as Jerry's, I think we do have to address the realities that there are many within our communities that have not had positive interactions with law enforcement. And within our schools, I think, that is where our teams need to be explicit about that and use, equity checks and cultural competency rubrics to really look at are the referrals that are coming in, which have nothing to do with law enforcement, are they disproportionate? And also, how we are responding to those referrals. Is there inequity in our response? And so, I think, part of the challenge is the view that threat assessment as a tool is a mechanism for law enforcement to get involved in people's lives in a nefarious way. And not just research, but experiences will suggest otherwise. And that is going to take time to rebuild. And it's going to happen through the community.
Yeah, and Michelle, you're right too. Like you talked about it, I can't remember who said it specifically, but there's a lot of silos, right? Whether they're by design or by accident, there's silos of information. And I have access to certain silos of information, and the school has access to different silos of information, and that team helps bring all those pieces together. And it's like, we can all talk about it, but when we're done at the end of that particular meeting, it's like, doesn't mean that what I share in that meeting is going to go outside of that meeting. It helps us make the better assessment, because I can see things that they can't, but they can see things that I can't. But how does that help us all make a better decision for the betterment of everybody?
Well, and that is one of the barriers too, that I think is an unnecessary barrier, and that is related to information sharing. I think there is, concerns about being over restrictive, and there are concerns about not being restrictive enough in terms of what information is shared and what our legal obligations are. And so I know, again, working with administrators, I've had to provide resources and education about what is not a violation of FERPA or what is not a violation of HIPAA, and that also brings in the, our other collaborators in this process, which is our community-based organizations and mental health providers in schools that are clinicians and not necessarily school employees.
I'm realizing we have about 10 minutes left, and I want to give folks an opportunity to ask questions if they want to. So thank you so much, all three of you, for your participation and your valuable insights into this discussion. But I'd like to open it up for public comment and questions if we can at this point. And remember, if you're joining remotely, you can ask a question by clicking the raise hand icon, or if you're calling in, you can push the number 9, star 9. Melissa, would you mind facilitating?
Sure thing. Stacy, I see your hand raised.
Yes, hi, Stacy Hiramoto with the Racial and Ethnic Mental Health Disparities Coalition. Commissioner Bunch, I felt that you asked a really good question about preventing the school to prison pipeline, but I don't feel that there was much of an answer. So I'm hoping that you, like maybe the panelists can elaborate on that. Thank you.
Yeah, so maybe I can help a little bit. Kind of like I mentioned earlier, I see it as like my role is like, I'm not just there to arrest a kid or cite a kid or any of those types of things. My goal when I'm working in the high school is to help coach that kid up. And so I try and avoid, those referrals to probation or the DA's office, or even arrest if I can, as long as it's in that situation where there's not a victim that is desiring some sort of prosecution. So there's some things that I just can't avoid, but on all the things that I can avoid, I try and divert that as best I possibly can, because, everybody in this panel was that age at one point, probably making a decision that was maybe brash or harsh in that moment. It doesn't necessarily mean that we're all should go to jail. It's just how do we talk to people? So kind of more on that, Stacy, is that I talk to people a lot, and I spend a lot of time, like 95% of my job is being an informal counselor to try and coach those kids up, so that way they're not going to make that transition to jail or prison or anything like that. That's my personal belief. That's the way I approach it.
Stacy, I would like to chime in on this as well, and Dr. Reeves might have some feedback to share as well. What I will tell you is that Dr. Dewey Cornell has led various research studies he's at the University of Virginia, and he actually wrote a letter to the legislature on behalf of some legislation that was presented in California that was being opposed by various groups because of the fear that this would open the school to prison pipeline. And the studies that were rigorous were actually funded, through various large scale grants, government grants. At any rate, the studies show that across, I think it was almost 700 schools that had vigorous threat assessment policies, procedures, teams in place, and that we're implementing those policies with fidelity, as they should be, that threat assessment was a tool that eliminated the disparities in punitive disciplinary strategies. So because it is the intention is not to result in incarceration, and in fact you'll see in the research that's out there that in systems that are using threat assessment, incarceration happens fraction, a very small fraction of the time, because it is effective in getting kids off the pathway to violence and wrapped around with supports across the settings. And so the letter, which I wish was public, and I don't know, maybe it is, actually goes through the research and the cherry picking of some of the data and explains the inaccuracies. And so in many ways, this is a tool that is not being used, that has the potential to create parity and how we respond to students who are at risk.
Thank you. No, I really appreciate it. This is not my area of expertise, so I do appreciate the legislature, though. If a letter was sent to the legislature, it is public information. So that can be released. I guess I would have to see the 700 schools if they were, what kind of school population, were they in low income areas, were they, what was the demographics of the school? Because
Yes.
correct
So
me
it was
if I'm
throughout
wrong.
the Southeast. So I think it was and Melissa may know this, I think it was like across 6 states. Like it was a very large sample.
Right, a large sample, but California schools are not minority majority. I don't know if I like that term, but correct me if I'm wrong, but Roseville is, compared to Sacramento, for example, Roseville is still, it does not have a large proportion of African-American students. At least I was looking at the stats for the West Park High School. They only had something like 4%. And I guess I really appreciate the information, and I would like to, look more into this. I guess I would feel as an advocate more, I would feel more confident if I heard parents from underserved communities and students from underserved communities understand this threat assessment thing and say, hey, it's great. We didn't trust it at first, but guess what? We like it now because so again, just a little thing on the presentation. It has nothing, again, I appreciate the information.
Thank you, Stacy. Thank you for your comments. And I also would really like to see the study, because when I hear about studies like that, or when I hear about everything that we're talking about, I'm also very cognizant of the number of minority youth and children who are referred to the SROs at the school as opposed to the counselor. And that contributes to that school to prison pipeline. And I would love to see the study just to see what that research looks like in juxtaposition to the research that shows that minority children are more likely to get sent to the school police officer or the school deputy as opposed to getting the appropriate mental health services. I think we had another hand up, Dr. Hollifield.
Yes, Dr. Joe Hollifield.
Thank you.
Hi, I'm Dr. Joe Hollifield. I am currently I'm a school psychologist, clinical psychologist in San Luis Obispo County, and I'm a recipient of a Mental Health Services Act Innovation Grant Award, finishing up my 4th year in San Luis Obispo County, funded by Behavioral Health. And we're finishing a 4-year project on integrating a K through 12 community-based threat assessment system. And we've been collecting data and so forth. So looking at schools, law enforcement, and behavioral health, we're kind of looking at those silo integration that I think Jerry talked about. And I've had the opportunity to listen to Melissa before. She's an amazing speaker. And I've worked with Michelle on a few things with Cass, so it's good to see everybody out. But I just wanted to let kind of, this is coming from the mental health angle. Part of the innovation piece that that we're trying to look at is training mental health providers in our community through our behavioral health private practitioners about threat assessment. And Melissa, Michelle, and Jerry have talked about, the school-based threat assessment, but having been a private practitioner in the community myself, is that, oftentimes, we get referrals from schools with kids with problems and they've had a threat assessment. So the question becomes is what are our mental health providers prepared to receive students, work with schools, from that standpoint? Because after we hear about a mass attack or a school shooting, is like, what's the mental health solution, right? And so I think that's where, I can see from behavioral health viewpoints, like what are our professionals prepared to work with students and to understand threat assessment and support schools in this way. So anyway, I think it's been a great presentation. I just wanted to voice that as well.
Joe, I think what, the one question that we didn't get to is what systems change efforts need to take place. And, I really think, to your point, we need to have the frameworks for community, schools, law enforcement, managed care, providers to be able to really look at, again, the highest risk cases and provide that continuity across settings and across the lifespan. And so that is a systems component that really, without that, makes this work incredibly challenging. And so while there are some communities in the state that are taking this on as an initiative on their own impetus, having the state recognize the need and help facilitate the pathways to developing this, not just within the field of threat assessment, but really looking at crisis prevention, intervention across the board.
Yeah, that's a good point, Michelle. I think that's kind of, it's one of those things of trying to figure out is we have the engagement of some of our mental health professionals outplaced into our schools and working with county behavioral health or working in what's their understanding of threats and are they educated and part of the school? If the schools are getting training, are they included or are they not included? I think, are they aware that they're being able to disclose HIPAA and WIC, welfare and institution code stuff and share information? Can they? I think those are, the way I view it is as a licensed professional in the state, a licensed psychologist and licensed educational psychologist, I'm required to take that suicide assessment and response. Where's the training and dangerousness to others that as therapists and what we're supposed to understand? We're required to under TerraSoft and to as a duty to protect. I don't know how much our therapists understand that in their roles. I mean, I think from a behavioral health standpoint, I think that's a crucial piece.
Yeah, and to piggyback on that, I've been involved in a lot of statewide initiatives. So for example, we're doing statewide threat assessment trainings or BTM trainings with K-12 schools in Michigan. And we're actually encouraging that they invite their community mental health providers, those that are working in the schools, but also even those that may get referrals. And that training has really opened up the conversations around how do we partner? And if we need wraparound services, what does that look like? If a student's going to graduate from K-12, but they're still going to need support as a young adult, how does that work? So we really, we definitely encourage that partnership. But I would say the lack of training is across the board. Not only with, community therapists I'm a licensed professional counselor. That was never in my master's program. It was never in my school psych program. I got it after the fact, but also and I've never understood this, but I don't know of any state that requires that school district superintendents and school district administrators have any mandated training in suicide risk assessment, threat assessment, or even crisis prevention, intervention, and recovery, but yet they're expected to know what to do in these situations, or they're expected to serve on these teams, or they're expected to be a leader in a crisis response. And I don't know of any state that mandates training in that area for even our school leadership. So this is where, you do get school administrators that will call in the SRO and say, you will arrest this kid. And the SRO's going, no, I'm not. Like, that's not what I'm here for. But because they don't have proper training, they're contributing to some of the disproportionality because they don't understand what all of this is and how this really is a preventative approach. So I would argue across the board, we've got a real significant deficit in making sure that people get high quality training to really understand what this is and how we do it the right way, coming at it from a collaborative problem solving approach.
Thank you. Thank you, Dr. Reeves. I'm also noticing the time. I feel like those were amazing closing statements. So thank you. Thank you to our panel members. Thank you, Michelle, Jace, Jerry, and again, thank you, Dr. Reeves. And everyone else who participated, thank you for participating. We're going to be sending out a written summary of the meeting. And on behalf of the commission, thank you everyone for attending. And thank you to the presenters and the panelists and everyone who jumped in with their questions. I think that Courtney is going to share her information on the screen for everyone.
Yeah, thank you. If anyone has any additional input, any questions, any concerns, please follow up with me. My email is courtney.ackerman@mhsoac.ca.gov. I'm going to see, Melissa, if I can just drop that in the chat so it's easy for everybody.
Hopefully everyone can see the chat. For some reason, I can't find it.
I think it's disabled.
Okay, I'll spell it out for everyone then. COURTNEY.ACKER@mhsoac.ca.gov. I'd love to hear from you.
And also a big thank you to Courtney for all of your hard work on this. Thank you. We hope to see everyone at the commission meeting next month for a full commission hearing on this project. In the meantime, thank you guys. Be well, take care. Good self-care this week with everything going on.
Thank you.
Thank you.